Hello, I'm Ann Tracy, and I am the author of the Blended on Broadband blog. I've been talking to a couple of different counties throughout Minnesota about whether broadband has been a help or a hindrance in dealing with COVID. I'm very excited today to be talking to some folks from Koochiching County. So thank you all so much for being with me. I might ask everyone to just do a quick introduction of themselves, and then we'll just get into, as I said, there's just the one question. Has broadband been a help or a hindrance? And actually, even in the introduction, well, we just dive right into it. So Isaac, if we can start with you, if you want to introduce yourself a little bit and let us know what your experience has been.
So I'm Isaac Meyer. I'm the Planning and Development Director for Koochiching Community Action. I should say I live in Grand Rapids, so I do not personally live in Koochiching County. And so as I talk about it, it's going to be our experience, through Koochiching and our work we do in the county. And I would say with COVID-19, it's been very helpful. Often I'm up in Koochiching County, several times a month. And with all of this, I've not been able to be up there. So from an operational perspective, it's been handy. And what I would say is broadband for our clients and for Koochiching, those we serve in poverty, it's a must. The challenge really is availability and affordability and pricing. And so much of our work has focused on that. And I'll probably maybe leave my answer for the discussion here for now because I'm not in Cooch full time. So I want to maybe leave some space for that and be happy to chime in on our work with the low income folks as we continue.
Great. Thank you. Yeah, I look forward to that. I was, a friend of mine runs a homeless shelter in Minneapolis, and I was just there yesterday because they just got some funding for some computers there to see what a difference that's going to make. So I'll be interested when we do kind of jump into that conversation. Ariana, your next contestant, tell us a little bit about yourself and what your experience has been.
Hi, you guys. Ariana Daniel, I'm the Director of Servants of Shelter. So we operate an apartment-based emergency shelter. It's a 5-unit shelter here in International Falls, and we also have a supportive housing building, which is 4-unit apartment building. And we do a lot of drop-in services out of our office. And due to COVID and ours, if we've been able to offer more than the few nights of overflow hotel stays that we've done in the past, we're now doing 2 weeks with case management. So we've definitely increased our services a lot this year. And as far as broadband, we've really benefited from the fact that there is good quality broadband in International Falls. The other parts of the county have a great discrepancy, as I'm sure other people will get into, but I mostly want to focus, and I'll try to keep it short, on how it's affected our clients' ability to, like you said, and I'm sure everybody acknowledges, is that when COVID hit, all of the inequalities that a lot of us are aware of became very stark and very daunting very quickly. And one of them was this. How many things had to go onto the digital front so quickly, and people who did not have devices and did not have adequate broadband were really left lacking. And so we saw our answer to that was that we partnered with, we used some of our Minnesota Homeless Fund funding. That was a one-time funding source that Governor Walz and Flanagan, Lieutenant Governor Flanagan started last winter.
Mm-hmm.
We used some of that funding that we had set aside for hotel stays and partnered with Koochiching Technology Initiative, which is a blending project that our communities greatly benefiting from, to purchase computers. And so we've been selling laptops at a really reduced rate of $50 is the guest contribution since July. And we're at about 8 laptops that we've had, and we have a volunteer from who's the iFalls city administrator, systems administrator for that, who programs them for us and puts a bunch of anti-malware and all of that on the devices and programs them to the specifications of what the client needs if they're going to use them for schooling or different employment. And so that's been really helpful because we realized that less than 25% of our guests in 2019 had a device other than a phone. And many of them didn't have a phone. So what I would really focus on is it's not just getting the devices into the hands of people who need them. There's also there's a lot that has to go with the quality of the devices And then also the ongoing technical support and accessibility for people who have not had a lot of experience using computers. There's definitely an age, you know, we have a lot of older clients who really struggle with some of and need a lot of support using the devices. And then we also just have people who have not had, aren't digital natives and haven't had a lot of experience. And so that does end up falling on our staff a lot. If there was, I think that's something we're going to be ongoing seeing as there's this move to create situations where there's better broadband and where there's more devices in people's hands. There's also a whole knowledge and comfort level and stuff that has to go with it. It's the technical support. And so when that's lacking, that's hard. And I know with the school district, they've seen, you know, the same thing. There's a lot of parents and families that are not, that are struggling to support their students because of lack of technical know-how, and it requires a lot of experience and a lot of comfort to be able to use these programs well. But we did see, I mean, for employment, for school, for applying for benefits, for telehealth, you know, the need for a good Wi-Fi signal, as well as a device that can connect well, and people, it became a necessity, I would say, really quickly. And so we saw before we got all the programming in place to sell the laptops, we have our computer in the shelter in our case manager's office, and then one loaner, and we were nonstop, and our office just, I mean, we were booked all day long trying to help people work through those processes because they did not have a device or the ability to do it themselves, and the library was closed, you know, yeah. Which is a lot of people had relied on. So I think it really, that's all I can confirm is that, you know, the digital divide is real. It absolutely affects people's ability to do the very most basic necessary things right now. And looking at it in like a whole systems approach of how we can make these things more accessible is important if we want to.
If I could add to that, you know, I think Ariana made a really important point of how much it is a necessity. You know, it's so much more than the job and the workforce in the finding. It's weddings, funerals, religious ceremonies. It is all of these forms of social connection that people just don't have the options for anymore. And for the low income folks, you know, in their work, maybe they never got to work with computers, you know, they're often older, they don't have that experience. And there were so many alternatives, and now there's simply no choice. And so that just the isolation, the barriers, and you know, when Ariana is saying it's booked full time and it's off, I'm sure for folks who before had all these alternatives and could function in those ways, but now none of us get to function in those ways. But you know, for those of us who've been lucky enough to have internet, right, I'm not at a disadvantage, but it's just so much.
Well, I think even for, and this used to be a bad example, but I think even just for keeping our sanity during that serious lockdown period, and I spent a lot of that time volunteering at an emergency shelter here, where, you know, kind of at 8 or 9 o'clock it's lights out, which is that's rough to begin with. It's even rougher if you can't be watching Netflix while you're sitting there from 8 o'clock on. You know, I mean, between juggling that and, you know, when there's a mandate to stay home, and as you said, the libraries are closed and there's nowhere else to, you know, what do you do? I mean, and do you serve families as well with only 25% having devices? What did kids do about school in the spring?
All of the school districts did their best to connect people with Chromebooks. And so we helped with that, making sure that our school district knew which students didn't have them and helping the families let them know. But it was, I mean, you know, the stress level of switching to distance learning for most families was pretty great. And for families that are experiencing housing instability, we had a few families, at least in the community that we were working with, that just decided to pull their kids out of school because they tried a few days and were just like, felt that they were incapable of supporting their students in the way that they needed to, and decided to focus on, those kids are back in school now this fall that I'm aware of, but it was really hard, you know, and it meant families had to make choices like that. Like they just felt like they just couldn't, you know? So yeah, it really impacts the kids, that's for sure, and the families. And I think in some of those cases, that was probably the safest and smartest thing, since they knew that it would be probably more stressful and harmful for the kids for them not to be able to support them, and for them to struggle through those last few months. But yeah, it's a lot. So I mean, I think, yeah, it's just drawn our attention, and especially for families with special needs kids, that's one of the factors in those choices, I think.
Now in Koochiching County now, are schools primarily in-person, hybrid? Do families I assume can choose if they want to stay home? What is the juggle?
Two school districts are in person, are more rural ones, and then our Falls School District, which is located all here in International Falls, is hybrid for junior high and for middle school and high school, and it's full-time for elementary. And then there's a distance learning option for all 3 school districts.
Yeah, teachers have got a heavy lift this year. They've got a heavy lift. Jim, thanks for joining. What we're doing is everybody's kind of doing a quick introduction and then talking a little bit about whether broadband has been a help or a hindrance. And we've heard from Isaac and Ariana so far. And Jackie, you're the next. If you want to tell us a little bit about what you do and what your experience has been with COVID and broadband.
Hi there, Ann. So I'm the IS director for Koochiching County. And I don't think they'll find anyone who says that broadband was a hindrance during this pandemic. I'll speak primarily on how things went for the county. So I literally within a 2-day time frame, we went from having no remote working to having everybody working remotely except for the technical staff. The painful parts came in when we had, for those people that live in areas without broadband access, without a doubt. I mean, we scrambled, we literally made dashes over to the Verizon store to get every jetpack they had because we couldn't get them online anyway. You know, I mean, we really, people and then when you have holes for cellular service too, that made it even worse, right? So definitely without a doubt, having broadband access is huge. A little bit on the personal note, I have a granddaughter who attends a Little Fork school, and she did not have internet access at home. And so using the programs, discounted programs, you know, my daughter worked to get enrolled with some of the discounted internet service, but it took a very long time. So they literally obtained their broadband service with 2 or 3 days left in the school year. So they were relying on a jetpack or a hotspot from a cell phone. And it was tough. School was very tough for her, even though, I mean, the school provided her with an iPad. They did the best they could, but you know, I don't think anyone saw how huge broadband internet was going to become until this pandemic hit, and it really has identified it as an absolute necessity. It's a fundamental utility that we're going to all have to have.
Yeah. I just can't imagine a 2-day turnaround for having everyone go remote.
You know, I was really fortunate. I had a IS technician start the day of the shutdown, and he came in. Without him, I might still be scrambling, but yeah, he did his part, pulling old equipment out and rebuilding it, while I worked on how are we going to connect this person remotely, right? Good team effort, and it happened remarkably fast, and I just kept waiting for the other shoe to drop and find out all these problems, and so far, knock on wood, they haven't happened.
Well, that's good. That's good. Well, you at least internally, you must be from, maybe not from the home side, you know, the remote side, but from the inside, you must have been pretty well poised. And
yeah, the county's lucky to be on the state of Minnesota's MNet broadband connection, right? So we have great service coming out of the Northeast Service Co-op, and also a redundant link out of Paul Bunyan. So we, you know, the county infrastructure itself is well suited. It's when you leave the county buildings that you have problems.
Well, good for you. Hopefully the shoe won't drop. We're all waiting for that. That's great. Thank you, Jackie. Derek, can I ask you to talk a little bit about yourself and what's been your experience?
Yeah, Derek Foss. I'm the Public Health Department Supervisor for Koochiching County. Broadband has been absolutely instrumental in keeping operations running, as well as our emergency response team, our emergency response coordination. Without WebEx broadband, WebEx being used through the broadband connection, we wouldn't have been able to do what we've done. We wouldn't have been able to coordinate all our resources and everything that we've been working with. Since the beginning of March, we've been meeting with many different organizations. We have special meetings with our healthcare providers, long-term care facilities, with schools. Everything's been being done virtually, just because that's how we have to do it now. You can't have those in-person meetings, and without broadband capabilities, we wouldn't have been able to do that. Echoing kind of what Jackie said, as far as where you're at in the county, makes a huge difference. That's the one big discrepancy we have here. In the International Falls, yes, we have great broadband connections in International Falls. My parents live a hair under 3 miles out of International Falls, and they can't stream Netflix at their house just because the internet is so slow where they're at. I hope that's changing in the future. My mom has heard that Paul Bunyan is going to be moving into the area, so hopefully that helps out with different parts within the next year or so. But it's definitely a discrepancy with school-age kids and working with the schools. That was one of the huge barriers that they had. These kids that needed to move to distance learning last spring, and they don't have a reliable Wi-Fi connection at home. They don't have fast enough internet to participate in a Zoom class or anything like that. It made it very difficult for a lot of them, and trying to figure it out and how they were going to do that. So there are the holes in the county, but I mean, this pandemic has just shown all of us that, good internet, fast internet, reliable internet is essential now.
Now, in those holes, do the mobile hotspots, do they work there? I mean, I've talked to some counties where they're just broad swaths with even the mobile hotspots won't work.
Certain places in the county, you're not going to have any sort of cell signal. Especially if you get out to the western edge of the county, western part of the county, drops off pretty quick out that way. Get a little bit south in the county, it drops off until you can get onto the Bemidji, Beltrami County area Wi-Fi or cellular network. But there's holes. I live 2 miles out of town. I have good internet, but we drop calls a lot from our cell phone signal, and we're 2 miles out of town. So
yeah, that's a challenge.
Yeah, so a lot of the kids that are, that live in those more remote areas of the county, they were at a real disadvantage when it came to being able to do their schoolwork and do it.
Yeah.
There's huge swaths of Koochiching County where seemingly your only choices are going to be satellite internet. And it's just kind of amazing that here it is, 2020, how long have we been working on trying to get broadband infrastructure out and even cellular towers, and your only choice is the 2 or 3 satellite providers for the whole country. I was talking with Kevin Grover, and they deployed the Wi-Fi hotspots that go on their school buses to 3 families who are in really poor areas, because that was the only possible way to get internet out there. So the lengths, that have had to been gone to, it's incredible, but amazing work by so many people.
It's brought out the best in so many people. I think, to see how everybody rallies, but some counties are better prepared than others. I mean, some of it is just that luck of the draw of, did you have broadband before?
Well, I might also offer in, I think it's important to understand that we have Canada across the border. And so Koochiching's experience, this is a border community. And I think that often gets forgotten by other people in Minnesota, right? There's no going a couple miles north and locating another tower over there. There's no we're going to bring in a fiber line that way. I mean, at least without attorneys. And I think it's important to know that changes things up fundamentally about what that ends up being like. It might be in small ways, but this is a border community.
Yeah, thanks for mentioning it. I think it is. And if I've 2 daughters in college in Winnipeg, so I'm very aware of the border, but I live in St. Paul. I mean, it's, that I forget about that aspect of it. You're not going to get the, that's
Yeah,
interesting.
that's a good point there, Isaac. Everywhere else has a radius that they can go around. We have a half moon. So.
When I have a challenge, I'm in Itasca County and I'm wondering what another Health and Human Services is doing, I will call Derek, and then I can call the 2 others next to me. Obviously, networks, can be wider than that, but it's just half. There's less.
Yeah.
Proximity matters.
Yeah. Well, and even if you were able to do some work cross-border before, it's a greater, some of us feel it very acutely, that closed border, and I'm sure there are communities there or families there that do too. So that's, yeah. Jim, you're up. Tell us about, and you're linchpin in many ways of what's going on there. So tell us about what you're doing and how it's going to help our hindrance.
First, I'd like to apologize for being late. Ironically, I am in the middle of dealing with a catastrophic local network failure on in my house and my guest house next door. I just replaced the key, simple piece of hardware, and I'm rebuilding everything now. And I could do it, but I'm taking a little break to do this. Meanwhile, we've got some guests who need to do their meetings, and my daughter is doing her homeschooling and all that. So definitely feeling it. But fortunately, unlike most people, I've got a reasonable skill set for troubleshooting that stuff at a reasonably advanced level. And a lot of people don't. And certainly we end up helping. We see a lot more calls now for, oh my gosh, what do I do? I haven't paid close attention to the details, but the school IT departments and other groups have really worked hard to get the families the support they need. I don't know how well that's going. I haven't heard that it's not going well. So I assume that it is going well because of excellent effort as opposed to because we got lucky. It's one of those
Right.
things, you solve the problem, then nobody knows there was a problem and everyone's wondering what people are complaining about. With the Koochiching Technology Initiative, we have been very busy with a little bit of reallocation of funds, which the Blandon Foundation graciously allowed all the Blandon broadband community groups to do. I'm guessing Ariana already talked about the laptops that we provided as part of that reallocation. I just met with her yesterday for other reasons, and she said that is going along very nicely, although of course laptop costs have gone up dramatically, particularly now that school started. There was a surge once the pandemic hit and people were stuck at home, and there was another surge now that school's back in for people to get devices. Slightly interesting because I think certainly our school districts and many others have done a great job of getting devices into the hands of people. In fact, ISD 361 here in the Falls, one interesting thing they did is they gave everyone a Chromebook whether they needed it or not. It was a non-optional thing, hardware, which is really interesting because then I don't know what all went into that logic. Obviously, some devices aren't going to get used, but it certainly eliminates any stigma issues of, oh, you had to have one of those dumb Chromebooks and I get this cool laptop that I'm bringing to school and, whatever. I don't think there's a lot of that, but I'm guessing that might have been part of the logic of what they did.
I would say tech support is easy if you know everybody's got a Chromebook.
Very much so. Yeah, that uniform,
that's saving there.
I'm appreciating that more than
today.
Yeah, at least the hardware I have is the hardware I install as a professional as well, so I'm pretty familiar with it. That's nice. Yeah, so we've also been doing a number of other things, such as our cooperation with Koochiching and Isaac here. He kind of picked our brains on how to move things forward for getting access to those who can't afford it in our area, who have the cable going to their home, but can't afford to connect to that cable. And the internet service providers in general have done a pretty good job of providing discounted rates, et cetera, during the crisis. I haven't been watching that closely. I'm sure Isaac has, but Isaac is seeing what they can do above and beyond that, either by negotiating with the service providers or by simply supplementing, paying part or all of the cost of their connection. Isaac, you may have already spoken about this, so sorry about the repetition. And yeah, generally, it's been busy. I also have Small Town Tech, a technology services shop in town, and like Jackie alluded to, and I did with the Servants of Shelter laptops, hardware availability is a worldwide issue. So there's only so much we can do to help people. Bicycles also, incidentally, are in short supply. So if you've got a used bike you wanted to get rid of, now is the time to to sell it to somebody who both desperately wants it and is willing to pay a little bit extra. Our local bike shop, in fact, ran out of patch kits. They couldn't repair flat for you. So lots of supply chain issues, but of course here in this context, we're talking mostly about tech, people's ability to connect to services, et cetera. Two very new developments, which won't pan out. Well, we'll see if they pan out in time to help with the pandemic. We'll see how long this all lasts. But our Koochiching Technology Initiative, Koochiching County, just was accepted as one of 3 counties to do a pilot project with Purdue University, which I'm sure you're quite aware of. Well, I know you're quite aware of. Looking at how to modernize communication with the public in general, communication engagement from government, civic organizations, nonprofits, businesses, anybody who wants to do that. So we are just starting up on that. Pretty excited about it. Still learning the scope of what it'll actually involve, but like many things planned, and to a very large degree, it appears it's whatever we want to make of it, and the Purdue consultants will help us do that. Meanwhile, you might know less, simultaneously, Koochiching Aging Options has started a totally separate project funded by the Northland Foundation and Arrowhead Council on Aging. Somebody correct me if they have the exact name, but something like that. And those two in collaboration with Koochiching Aging Options to look at how to just basically an overhaul, as I understand it, of looking at what are the issues that the elderly are facing, those who care for them, both family members and professionals and volunteers. Part of that is engaging with those population groups and having that good communication. And it's great that those two things are happening simultaneously, the Purdue Digital Ready Community Project and the Koochiching Aging Options effort. Since they overlap nicely, it'll be really good to see how that goes. And I've certainly seen that. I've had it as a internet service company. I've had to run a little old lady jobs. One of whom was this wonderful woman who's trying to take care of her husband who now has dementia, and she's trying to look at how to monitor him. And one thing that came up was she had heard of Koochiching Aging Options, but she never really talked about them. She knows the director personally, but not professionally, not as. And so it was just an interesting sign that I just happened to run across anecdotally of that need for engagement, getting the word out, and so many people that just aren't aware of what is out there, or for whatever reason choose not to reach out to and engage with those services. There's so much, but having that broadband background is critical. It's interesting, as you may have already spoken about. ATI helped this effort happen to get Paul Bunyan Communications involved in our community, and they are going to cut the number of people who do not have high-speed internet in our county in half. And when I say do not have, of course, as Isaac would remind me, do not have access to it if they have the money to pay for it. Them being able to pay for it is not something we take for granted, but they'll at least have that fiber to the home in those locations. We started all that before the pandemic hit, but unfortunately, it's not expected to go live until beginning of next winter, maybe sooner, but they're not promising anything. Hopefully by then we've got the pandemic reasonably well under control, because that's basically a little over 12 months from now. So we'll see, but it's framing the pandemic nicely. You can only move so fast to accelerate such efforts. So anyway, enough from me for now.
The one thing that we haven't talked about, we talked about the schools a little bit and the healthcare a little bit and the affordability and local businesses. Does anybody in the room know what local businesses are doing, both just in terms of some of the Main Street businesses? How are they doing? And have they been able to incorporate some broadband into doing things differently, and others?
I know the Chamber of Commerce was looking at getting a set of hardware together for, I think it's something like a mobile presentation studio. It's beyond just holding Zoom meetings. But they were looking at getting that hardware to help local businesses do whatever they need to do. Also for chamber events, offsite events, they've made their local Zoom facilities available, I think, as long as they're not otherwise being used for groups to come in, as have other entities. The Veteran Services Office, through Bland and Broadband Community Funding, they put in a very nice telecommunications room primarily to serve veterans' needs with telemedicine, et cetera. And from the very beginning, they were saying, you know, when it's not being used for those things, other organizations and businesses could come in and make use of it. Whether they have or not, I have no idea. Jackie, you might know. The City Hall has made some upgrades. They might do that as well. Go ahead, Jackie.
There hasn't been any takers yet
Okay.
with the VSO system.
That could be another situation where people might or might not know of the opportunity, or they might feel their needs are adequately met, or they don't want to be a burden or whatever. So anybody else have some thoughts to throw in on the how businesses are responding?
To toss out, I think a really important thought, and I think it's so important, is to just remember that pretty much nothing would be happening without the broadband services we already have for our businesses. You know, Jim, obviously small town tech, I mean, probably the backbone of everything you guys do. But as we went into pandemic mode and, you know, public health emergency and quarantines, I think things would have fallen apart almost entirely for so many businesses. You know, I think we're at that lucky state where the question for a lot of businesses is, you know, managing their current debt while trying to continue operations. Whereas if we didn't have broadband at all, it would just be, how do I manage debt and not, you know, have a millstone around my neck? And so I think that's just a really important thing to remember, especially for our communities where it can be a long drive. I mean, between even Little Fork and International Falls, and having, you know, these types of conveniences is just insurmountable. And obviously, I think this pandemic has really highlighted that need. You know, think about all our mental health practitioners, all of our health practitioners who, you know, bill Medicaid, Medicare, and now all of their clients are remote. And I know you mentioned healthcare is separate, but I mean, whether we like it or not, we've made healthcare an enormous part of our economy. And if that crawls to a stop, not only do people, does our health decline, but that's a lot of wages and a lot of work in our communities.
Sorry, writing that down. Because you know, that's an important point, that you know, that aspect of healthcare being such an economic factor in the community.
Jim's mentioned the Arrowhead Area Agency on Aging, but we have an older population and they want to stay in this community, and having broadband at even what they do have is key to that. You know, and I've seen the email discussions going back and forth. How many people are moving into Koochiching County, into our surrounding areas now from out of state? You know, that you know, think of a certain lake I know in Bemidji, there's 6 new residents from California year round, right, in the last 5 months. This is, I'm hearing it from realtors, right? This is a new reality, and it's because broadband is in our community, right? We've got new residents buying homes, bringing in money that are working remote. That's never would have happened if we didn't have broadband.
Interesting points you bring up on the availability of skills and support and training opportunities, and with the Arrowhead Aging group. You know, one of the reasons we started Small Town Tech, it's obviously a for-profit business, but there needs to be that level of professional services available to meet folks' needs within a reasonable driving distance, because distance equals time equals cost at that point. So it was partly to serve those needs that we did it. But, you know, we're well aware that we can't meet all their needs. We can't meet economically. And in the context of aging, one of the things I'd really like to know more about is where people have been really successful at tapping into youth to help the elderly learn how to use their technology. And that's not a new concept, but in the modern era of things being really gumped up, you know, each of the, well, probably 6 jobs in 2 weeks that I did that happened to be for little ladies, all wonderful people. I asked each of them, do you have a grandkid or a child that can help you learn some of this? And most of them said no. I suspect that could have been partly because of COVID-related isolation, that yes, they have that kind of person in their extended family maybe, but they don't have access to them now, not on site anyway. But some of it was just, no, they didn't have access to that at all. And, you know, age-to-age program. I think that's within the purview of what they potentially do, but I have not heard of any places around the world where they've got just an awesome model. I think it primarily is going to require, you know, the right volunteer coordinators putting in real time to make that happen, and finding the right kids to do that, and hooking them up with the right old folks. That's a lot of work, making those connections. And you know, I think that's one of the most important things to do for getting people that basic internet connection that they need for telemedicine, for checking their bank statements, everything, but also just for social isolation. If all they're doing is, you know, helping these people get access to the internet so that they can have social virtual contact with people online, that's no small thing, particularly with the giant aging process we have. So, you know, I think about every once in a while that crops up, and I don't have the time, knowledge, model, skills, or whatever to make it happen. But I would love to see something like that happen. And if you have a model, you know, we still have money to reallocate from for Koochiching Technology Initiative if possible, but we've got to have a realistic way to actually put that money to actual positive effect. Any thoughts people want to share on that would be quite welcome.
I wish I had a good idea.
Right.
It's a very difficult one because it's, you know, because COVID. I mean, it's just my daughter just saw my parents for the first time in probably 2 months Monday night over dinner. You know, I mean, it's you know, and it's hard for a kid to want to do yet another Zoom call.
It is one of the things I'm hoping to, I will in fact be exploring and bringing up during that Koochiching Aging Options 6-month overhaul of, you know, what their mission is, what the needs are, et cetera. And, you know, hopefully through that effort, we can tap into something and get some traction on deploying that resource of youth who know a lot with folks that need that knowledge on that one-on-one thing that's just totally not cost effective. You know? I can't charge my hourly rate to show somebody how to, you know, get the web browser running on their phone and stuff like that. It's just not viable. So anyway, thank you.
So you could have the team going for you. Yeah, it is. Or we do a lot through family Zoom calls. A lot of lessons are learned there. I love that. So that's. Do you see some things that are changing that you know, because of COVID, that you know are going to be carried beyond the time of COVID?
Well, I think the flip side of what we were just talking about is because people had to use video conferencing, et cetera, that now has a much greater depth, not the technology, the software, the knowledge, the comfort level. You know, people who would never ever want to touch that kind of remote conferencing, but could figure it out, have now figured it out, and they can tell their neighbors or whoever and help spread that word. And that will continue to a certain degree after the pandemic has hit. Certainly, I'm sure I can't imagine there'll be less funding available to get broadband internet connections to people's homes, et cetera. So it's drawn attention to the needs and gotten a little kick in the butt on on modernizing things in that way, which it's going to have some negative consequences as well, but there's going to be a lot of positive ramifications from that too, I think, carrying forward.
If I could toss out one, I don't know if it's going to stay, but I really hope it would. And that's been the exceptions for Medicare and Medicaid to allow those telepresence visits. Enormously important. Enormously important. I don't even know how to express how crucial that has been on the mental health care side and the physical health care side. Obviously, that all needs the big caveat of incredibly dependent on internet access and who has it. And sometimes you'll even be surprised what doctors don't have it at home. But maybe to ask, I'm curious, Derek, how that has been for your side of things or for your clients, because we've had clients we thought were not going to survive COVID who are still around probably because of that. And I say that as in people in precarious mental health situations who are probably not going to make it without perhaps seeing institutionalization or a hospital visit or, you know, serious harm.
I can't speak too much to how it would affect the mental health clients. We don't, in public health, that's handled in social services. I see Kathy popped on here. She might be able to answer that a little bit better, but we don't work directly with mental illness per se. Some of our clients obviously do have mental health issues, but social services is the ones that works directly with folks with mental health issues.
And Kathy, welcome. When everyone is done, sort of do a little introduction of yourself and what your experience has been, and whether broadband has been a help or a hindrance in dealing with COVID. I don't know if you have the ability to join the conversation.
Yeah, I am the director of Public Health and Human Services, and certainly we haven't had a lot of trouble with people having access. At least I haven't heard about that as being a main concern, but it's really, it's vital for people to be able to connect with other people. And, you know, so much of that is done through the Zoom meetings or other telemedicine things, you know, with the counseling centers and everything going to telehealth more. It's really important for people to use that. I haven't have any, I haven't heard of any real problems with that for anybody. I think, you know, I think everybody is still getting the services that they need, and people are figuring out, you know, how to be able to do that with them. You know, our workers are still very active with people and trying to make sure that they receive the services they need and stay in the best health that they can.
That's good. From different communities and different situations, I've heard that it's been a boon for younger folks, you know, to be able to connect with a therapist or other help remotely. Means that person doesn't have to be in your zip code, which opens you up to, you know, you just have a wider number of people to choose from. And sometimes it's even better if it's not your cousin's neighbor who's you're talking to some of the time. And then, you know, inherently with kids, if you're doing traditional services, someone's got to drive them there and drive them back. And so that's been, but on the flip side, I've talked to people who have been in social services who are dealing with people who are older, and it's been tougher because they don't have the fluidity with the technology. You know, I think that's been an issue too.
If I could note, Jim made a comment earlier that sometimes it's hard to tell when things go well, whether it's, you know, a lot of excellent hard work. And I think that's really kind of the case, as Kathy mentioned, you know, people getting the services. It's because a lot of people are working hard to make it happen. And so many different parts have all said, we're going to make it happen. I think that's really the key that's been kind of underpinning that.
It's telling that when I ask you if it's a help or a hindrance, you have all talked a little bit about the different holes for services, and obviously there's an affordability issue and a device issue, but without hesitation, you've all said a help. You know, some counties are in different positions where the broadband has just been a roadblock because they just don't have it at all, you know, and that does speak to the attention that's been paid and the work that's been done. And as you say, yeah, it's one of those, especially when you work in technology, and if everything goes well, you never get a thank you because nobody noticed, you know, which is how we want it to be.
I would say too, returning to the mental health piece of it, that some of our folks who live with real severe mental illness have really benefited from the telehealth. Like what Isaac was saying is, you know, it doesn't require them leaving where they are if they have a safe place to be to make their appointments. So they're making their appointments with more frequency. They're getting their medication refilled. They're able to be more stable, and that has been a great help. Where we've seen a lot of broadband being, or just the face-to-face services not being available, being a challenge is with our folks who do not have that ability and who are seriously mentally ill, because we're seeing their symptoms much much more exacerbated during this. And so, and then the crisis mental health isn't doing face-to-face as much. So all the other crisis services, including ours, are kind of trying to work processes that don't work when people are in severe mental illness and need stabilization. And so that's been hard, and we've seen a lot more of that these last couple of months because everyone's experiencing more anxiety. All the symptoms are just going stronger as people are looking for safety and some sort of reassurance. And it's a very, very hard thing to be homeless, as in a pandemic. So so that part of it, the lack of face-to-face crisis services in some of it has been very difficult.
What I might add to this conversation that I think might be important to understand is the internet has become perhaps the most important way for a huge portion of our population who are going through challenges with COVID. And honestly, we all are. Whether it's stress, mental health, basic resources. Our internet traffic at Koochiching has about tripled, right? The number of people who are finding us through searches, the number of people who are seeing our websites. And I am confident that is the same for every single, for the county social services, for all the programs, all of the things out there, first call for help across the state and nation there. And I should say 211, the 211 network, our local providers first call for help, that has all gone up so high. And we really kind of, Jackie said it earlier, but this is really a utility, right? It's the basic need for people to find the things they need. And when they don't have those options, to go find through the internet, the friction that exists for even the simplest of things can be so much higher. And you talk about stress, the mental illness and barriers, that can become a huge one as soon as they can no longer, just pop into county public health or our offices at Koochiching, or even, the homeless shelter because of all these challenges. So I would just toss out that there's so much that we never even see because people are self-serving now because they have no choices. And bad or good, it's a change.
Yeah. It's a good point. Yeah, if you don't if you don't have broadband, you don't have the services that increase the need for the service. I mean, it's just a vicious cycle.
Have there been any groups that have pointed out some way in which having broadband has had a downside in this response?
No, it's really not having it is a hindrance.
Sure.
I mean,
the only thing I can think of is, those organizations that have so shifted to providing things online that the people that don't have an internet service are falling through the cracks. But I think there's a lot of attention being paid to that, a lot of awareness of that in general. And I would certainly say that I think it's fair to say our county is not on the cutting edge of having everything digital. So I don't think that's an issue that's too strong for us yet. But anyway, thank you.
Well, and even some of the counties that are more, where they have fiber to the home to most folks, the counties recognize they still have to provide services to people who want to walk through the door or want to make a phone call or want to do something else. So it's businesses are different. You may run into some, if you and if your customer doesn't have broadband, that's a loss to them. That's a loss to you. If they can't see your menu and order curbside, that but that's a different kind of a loss. I think yeah.
Derek, were you or anyone else in this meeting here able to speak to the COVID emergency response team and how this has affected their actions?
Yeah, I spoke about that earlier, just how without the broadband connections and the access to WebEx and Zoom, and we wouldn't have been able to coordinate anything that we have coordinated here. It would have been absolutely impossible to accomplish all the things that we've accomplished since the beginning of March without access to good quality broadband. So
excellent. I know one of the things that KTI funded with the Blandin Broadband money was a mobile data network system, which I'm not sure exactly where it lives within our emergency response team, but I imagine that's all the more valuable now, given how under the COVID situation, having an internet connection is all the more critical, having that available in case one of our local networks does go down for a hospital or whoever. as opposed to, one of the main use cases before was fighting a fire in a remote area of the county that just doesn't yet have good internet access. That's one thing, but we're in a much more serious situation. It would be even worse than usual if, say, the internet went down at the hospital because the fiber got cut. Well, this tool is there to step in and keep things working. So.
Absolutely. Yeah, and that tool, I know they've tested that at a few different areas, and it works fantastic. Out in the middle of nowhere, it works because it has a booster for the cell signal and everything else. It's very techy. I don't I don't have the knowledge around that, but yeah, it's quite an amazing thing.
We're selling a few cell phone signal boosters these days through our shop, but actually surprisingly fewer than we thought, although that's okay because they're also in short supply with the supply chain. So we've got a couple in stock now. But yeah, if nobody buys them in the next week or two, I'm actually going to buy one of them for my property as well. But anyway, it's all good. Thanks, Derek.
Nice. I love the idea of the mobile data network system. The long history of the internet in Minnesota, and I worked for MRNet 20 some years ago, and so one day back in the day, someone lit a fire under the bridge and all of the internet went out in Minnesota, and I worked at the ISP at that time. So it's that being able to bring in a network. So I can see we're losing people and we are kind of at the hour mark. Jackie, I think it's you and me. Got any parting comments? Or Kathy, I can't see, but if any last things you want to say?
Not really. All I can say is that I would agree that we've seen a huge change in our community. By and large, people are nicer. They want to help more, right? And I think we've seen a small change in our county board. They're more mindful of the need for broadband access. And I think that's great, right? Because the work that KTI is doing is reliant on the county backing it more. And I feel that we're just getting a lot more traction underneath those efforts. And it's unfortunate it took a pandemic to bring that to the forefront, but it's really, I see good things coming in the future.
I think you'd agree. We were making good progress with the county commissioners and the rest prior to the pandemic as well, but it certainly has underscored things.
It has definitely underscored the need.
Making the case about the need for this or that broadband related thing is much easier these days.
Yeah, that is true. That is true. Kathy, do you have any final?
No, I don't have anything to say. I do think it is really, really important for people to have access, and anything we can do to help that grow is a good thing.
Yeah. Well, and I think that Jim and Jackie point out the attention in the gap that COVID has brought about is making a change. It's making a change. I'm going to leave it. Thank you. So I'm going to leave it on that people are nicer note. Let's leave it right there. That's going to take me through my day. Thank you. Thank you so much. Thank you for your time. I appreciate it very much. Thank you, everybody. And I will try to have this all written up and online by tomorrow. Maybe this afternoon if I'm good. So.
All right. Well, thank you, Anne.
Thanks
We're
a
looking
million.
forward to that. Looking forward to sharing that.
Yeah. Have a great day. Thanks.
You too.